In this video, you will learn why garlic, despite its well-known benefits, can actually be harmful. We will explain who should absolutely avoid consuming it, what processes it triggers in the body, and how this can negatively affect your health. Everything is based on current research conducted by American medical centers and is presented in a clear and easy-to-understand manner. If you believe that garlic is suitable for everyone, be sure to watch until the end. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. 1. Avoid garlic if you have gastritis with increased acidity. Today, more than 1 billion people worldwide suffer from gastritis, and over 60% of them have the form associated with increased acidity. This means that every third case of gastritis is linked to an excess of hydrochloric acid in the stomach, which damages the mucous membrane and causes burning, pain, heaviness, and nausea. Garlic, in particular, can significantly worsen this condition. Although garlic is valued for its natural antimicrobial properties, it becomes a powerful irritant for individuals with hyperacid gastritis. The reason is that garlic, especially when raw, strongly stimulates the secretion of hydrochloric acid. For a healthy stomach, this may go unnoticed, but for a stomach with an already inflamed lining, it is an additional blow that triggers a chain reaction. Increased irritation, a burning sensation, pain, nausea, and heaviness, particularly in the upper abdomen. Many people experience these symptoms just 20 or 30 minutes after eating food containing garlic. In the year 2023, the University of Michigan Digestive Health Institute conducted a study observing 214 patients with confirmed hyperacid gastritis. For 1 week, they included just 1 clove of raw garlic per day in their diet. By the 5th or 7th day, more than half of the participants, 58%, experienced a flare-up. Heartburn returned, there was a feeling of pressure in the stomach, and some patients developed nighttime spasms. Garlic was especially poorly tolerated when consumed on an empty stomach or with fatty foods. Even if you are in remission, garlic can sneak in unnoticed as a trigger, especially during times of stress, irregular sleep, or overeating. This can lead to the need for another course of treatment and limitations on your usual diet. How can you determine at home whether you have gastritis with increased acidity? It is simple. If you feel a burning sensation behind the breastbone after eating, heaviness in the stomach, or a sour taste in your mouth, especially on an empty stomach, these are possible signs. There is also an old home method. In the morning, without eating breakfast, dissolve half a teaspoon of baking soda in half a glass of water and drink it. If you burp within 3 minutes, this may indicate increased acidity. This method does not replace a gastroscopy but can serve as a reference point. If you have gastritis with increased acidity, you should completely eliminate raw garlic from your diet. During flare-ups, do not consume garlic in any form. Even in remission, you should avoid eating garlic on an empty stomach or as part of heavy meals. It is best to consult a gastroenterologist before reintroducing garlic into your diet. 2. Avoid garlic if you have a stomach ulcer or a duodenal ulcer. Garlic has long been considered one of the most powerful natural antibacterial foods, and it is often used in home remedies for everything from the common cold to infections. However, when it comes to stomach ulcers or duodenal ulcers, garlic can have the opposite effect. It can significantly worsen the condition. When a person with an ulcer consumes raw garlic, especially on an empty stomach, it causes a sharp increase in the secretion of gastric juice. Allicin, the active compound released when garlic is crushed, irritates the already damaged mucous membrane. As a result, symptoms intensify: burning, pain, nausea, and for many patients, nighttime episodes of heartburn that interfere with sleep. In the year 2024, the University of Michigan Digestive Health Center conducted a study involving 312 patients diagnosed with peptic ulcer disease. Among those who continued eating raw garlic for 2 weeks, 68% experienced a worsening of their condition. Some participants reported the return of pain that had previously subsided during treatment. Meanwhile, patients who completely eliminated garlic from their diets reported stable improvement in 73% of cases, along with a reduction in the use of pain medications. An additional risk factor is consuming garlic in the form of dietary supplements or concentrates. Even if you do not feel burning immediately, the active compounds still reach the stomach and continue to erode the protective mucosal layer from within, which may trigger a relapse of the condition. Completely eliminate raw garlic, garlic tinctures, oils, and capsules, especially if you have an active ulcer or have experienced flare-ups in the past. Boiled or baked garlic may be allowed in minimal amounts, but only after consulting with a gastroenterologist. 3. Avoid garlic if you're taking blood-thinning medications. Garlic is considered one of the most powerful natural substances capable of thinning the blood. Because of this property, it is often recommended for preventing blood clots and improving circulation. However, if a person is already taking blood-thinning medications such as warfarin, apixaban, dabigatran, or rivaroxaban, garlic can shift from being a helper to becoming a serious hazard. The active compounds in garlic enhance the anticoagulant effect of these medications. This means the blood becomes even less capable of clotting, and as a result, even a small internal injury, for example, in the stomach or intestines, can lead to blood loss that a person might not immediately notice. This is especially dangerous for people over 60 years old whose mucous membranes are less resistant to aggressive influences and whose bodies absorb medications differently. In the year 2024, the American College of Clinical Pharmacy published the results of an observation involving 458 patients who were taking both anticoagulants and raw garlic. Among those who consumed more than 1 clove of garlic per day, the risk of developing gastrointestinal bleeding increased by 26%. This was particularly true for individuals who had been on long-term medication and did not inform their doctor about regular garlic consumption. It is important to understand that such a reaction can occur suddenly, especially when taking garlic supplements, where the concentration of active substances is much higher than in a regular clove. Even short-term combination use can alter blood clotting levels, which may require immediate adjustment of therapy. If you are taking anticoagulants, be sure to consult with your doctor before adding garlic to your diet. It is best to completely eliminate raw garlic and avoid any supplements containing it, especially if you are over 60 years old or are undergoing treatment following surgeries, strokes, or heart attacks. 4. Avoid garlic if you have hyperthyroidism, overactive thyroid function. Garlic is often referred to as a food that speeds up metabolism. It truly stimulates the endocrine system, enhances thermogenesis, and can even slightly increase heart rate. For someone with a healthy thyroid, this stimulation can be beneficial, especially if they are struggling with sluggishness or a slow metabolism. But the situation is entirely different for a person who has been diagnosed with hyperthyroidism. With hyperthyroidism, the thyroid gland works in overdrive. It produces more hormones than the body needs. This leads to accelerated metabolism, weight loss, nervousness, excessive sweating, a rapid heartbeat, and insomnia. In this case, garlic acts as a catalyst. Its natural compounds, including allicin, increase heat production and further activate the endocrine system, pushing the body toward a state of overload. In the year 2023, the National Endocrinology Institute in the United States conducted a clinical observation of 126 patients with hyperthyroidism. It was found that when consuming more than 2 grams of garlic per day, approximately 1 medium clove, 43% of participants experienced intensified symptoms. Their heart rate increased by 10 to 15 beats per minute. They experienced hot flashes, anxiety, and insomnia. The worsening of symptoms occurred especially quickly in those who consumed garlic on an empty stomach or in the form of concentrated supplements. It is important to note that most participants did not associate their declining condition with garlic, as they were accustomed to thinking of it solely as a healthy product. However, endocrinologists pointed out that in cases of hyperthyroidism, garlic can be a hidden trigger for flare-ups. If you have hyperthyroidism, do not consume garlic regularly, especially not in raw form or in large amounts. Completely avoid garlic supplements, capsules, and concentrates. Including a small amount of cooked garlic may be possible, but only after consulting with an endocrinologist. 5. Avoid garlic if you have hypotension, low blood pressure. Garlic is known as a natural remedy that helps dilate blood vessels and lower blood pressure. For people with hypertension, it can be a real ally. But if your blood pressure is already below normal, garlic can make things worse and disrupt your usual daily rhythm. The reason is that garlic acts as a natural vasodilator. It widens blood vessels and improves blood flow, reducing resistance in the arterial system. This is beneficial for high blood pressure, But in the case of hypotension, which means low blood pressure, this process becomes risky. Blood pressure can drop even lower, causing dizziness, weakness, and quick fatigue, especially during physical activity or in hot weather. Some people may even faint when getting out of bed quickly or simply changing body position. In the year 2024, the American Heart Research Center conducted a study on a group of elderly individuals whose baseline blood pressure was below 100 over 60 millimeters of mercury. When they consumed 1 to 2 cloves of garlic daily, 34% of the participants experienced episodes of temporary vision darkening, dizziness, and in some cases, fainting. This occurred most frequently in the morning or during hot weather when blood pressure naturally tends to be lower. Garlic in the form of concentrates or tinctures turned out to be even more dangerous. Among participants who took garlic extract supplements for 7 days, systolic blood pressure dropped by an average of 8 to 10 millimeters of mercury. This may seem like a small change, but when combined with already existing hypotension, even such a difference could lead to unpleasant consequences, especially in people over 60 years old. If your blood pressure consistently stays below 100 over 60 millimeters of mercury, eliminate garlic from your diet, especially in raw form and as a supplement. If you experience occasional drops in blood pressure, avoid garlic on days when you feel weak or during hot weather. Be sure to consult a cardiologist before reintroducing garlic into your diet. 6. Avoid garlic if you have liver disease. Garlic is often called a powerful metabolic stimulant. It activates detoxification processes, improves circulation, and supports the immune system. However, in the case of liver diseases, whether it is fatty liver disease, chronic hepatitis, or fibrosis, these properties of garlic can become problematic. Instead of helping, garlic places an additional burden on the liver that it may not be able to handle. The liver is the body's main filter. It processes everything we eat, drink, and inhale on a daily basis, including the active components of food and medications. Allicin, the primary biologically active compound in garlic, increases the activity of liver enzymes. A healthy body can tolerate this, but if the liver is already inflamed or weakened, such stimulation can lead to overload. In the year 2023, a research group from the UCLA Liver Disease Research Unit observed 162 patients with chronic liver conditions. Those who took garlic in supplement form, an average of 600 milligrams of extract per day, for 2 weeks underwent tests for liver enzymes. In 29% of participants, levels of alanine aminotransferase, ALT, and aspartate aminotransferase, AST, increased, indicating added strain and irritation of liver tissue. This was especially true for individuals with hepatitis C and fatty liver disease. It is also important to note that most of those affected were taking garlic in capsule or tincture form, expecting it to have a healing effect. However, it is the concentrated form that causes the greatest strain, as the substances act more quickly and more intensely. If you have liver disease, avoid consuming garlic in the form of supplements, extracts, or tinctures. Only minimal amounts of cooked garlic, no more than half a clove in a prepared dish, should be included in your diet, and only after consulting your hepatologist. 7. Avoid garlic if you have pancreatitis during an active flare-up. Pancreatitis is inflammation of the pancreas, an organ that plays a key role in digestion and enzyme production. When the pancreas is inflamed, it becomes especially sensitive to any foods that may stimulate its activity. Garlic is one of the most aggressive triggers on that list. The active compounds in garlic, such as allicin, can stimulate the production of digestive enzymes. In a healthy body, these enzymes are released only when needed, during food digestion. But for someone with pancreatitis, this process can become uncontrolled. The pancreas begins to release enzymes before it is ready to safely send them into the intestines. As a result, the enzymes start to digest the tissue of the pancreas itself, leading to sharp pain, nausea, vomiting, and a worsening of inflammation. In the year 2024, the Stanford Digestive Health Center conducted a clinical observation of 137 patients with chronic and acute pancreatitis. The results showed that when consuming just 1 medium clove of raw garlic per day for 5 days, 61% of the patients experienced a worsening of their condition. Participants reported increasing pain in the upper abdomen, digestive issues, and a significant drop in energy. Garlic in the form of supplements or concentrates is particularly dangerous for those with pancreatitis. The concentration of active compounds in these forms is several times higher than in a regular clove of garlic, and even a single capsule can trigger an attack. It is important to understand that even after emerging from the acute stage of the disease, when the condition seems stable, the pancreas remains vulnerable. Reintroducing garlic into the diet too early can undo the effects of treatment and cause another flare-up. With any form of pancreatitis, especially during an active flare-up, completely eliminate garlic in all forms: raw, boiled, roasted, and especially in supplement form. Even during remission, do not reintroduce garlic into your diet without approval from a gastroenterologist. 8. Avoid garlic if you have irritable bowel syndrome, IBS, excessive gas, or bloating. Many people consider garlic a healthy seasoning without thinking about how it might affect the digestive system. But if you suffer from irritable bowel syndrome, frequent bloating, gas, or cramping, garlic may be one of the hidden causes of your discomfort. Garlic contains a group of substances called FODMAPs. These are short-chain carbohydrates, such as fructans, that are poorly digested in the small intestine. Instead, they pass into the large intestine, where they become food for bacteria. During the fermentation process, gases are produced that stretch the intestinal walls. In a healthy person, this may go unnoticed, but in those with irritable bowel syndrome, the reaction can be very intense: bloating, pain, gas, diarrhea, or on the contrary, cramps and constipation. In the year 2023, the American Digestive Wellness Foundation published data from a large-scale review involving 842 patients diagnosed with IBS. The study found that 64% of participants experienced worsened symptoms after consuming even a small amount of garlic. For example, half a clove added to a sauce or salad. Patients who ate garlic in raw or fried form had especially strong negative reactions. These forms contain the highest levels of active FODMAP compounds. Even garlic powder, which is often found in prepared meals and processed foods, can cause a similar effect. Many patients do not associate their symptom flare-ups with this ingredient because they do not taste it directly, but the body still reacts, especially during periods of stress, fatigue, or disrupted sleep. It is also important to understand that people with IBS have heightened intestinal sensitivity. Even slight bloating can feel like intense pain. Therefore, garlic, even in small amounts, can truly ruin the entire day. If you suffer from irritable bowel syndrome, excessive gas, or bloating, completely eliminate raw, fried, and dried garlic from your diet, including garlic powder found in sauces, marinades, and prepackaged foods. Instead of garlic, you can use aromatic oils without actual garlic particles or spices that do not contain FODMAP compounds, such as turmeric, dill, or ginger. 9. Avoid garlic if you suffer from migraines or have a sensitivity to sulfur-containing compounds. A migraine is not just a headache. It is a neurological condition that can completely disrupt daily life, bringing nausea, sensitivity to light, and pulsating pain that makes it difficult to work or rest. People who experience migraines often know that each person has specific triggers. One of these triggers, surprisingly common and particularly tricky, can be ordinary garlic. Garlic is rich in sulfur compounds, most notably allicin, which forms when a garlic clove is crushed or chopped. This is what gives garlic its sharp smell and intense activity. But for the brains of some individuals, these compounds can be harmful. Allicin can affect the tone of blood vessels, causing either dilation or, in some cases, spasm of the brain's vessels. Either reaction can trigger a chain of events that lead to a migraine episode. In the year 2024, the New York Headache Center conducted a clinical study involving 246 patients with confirmed migraine diagnoses. In 18% of participants, garlic was identified as a clear trigger. Their migraine attacks began within 2 hours after consuming food that contained raw garlic or dishes with a strong garlic flavor. Patients who were unaware of garlic's impact and continued eating it regularly reacted particularly strongly. A separate group of participants kept a food and symptom journal. After eliminating garlic from their diets, 61% of this group experienced a reduction in migraine frequency by at least 1/3. This led researchers to conclude that garlic may not be a universal cause of migraines, but for people with a sensitivity to sulfur-containing compounds, it poses a potential risk. Even small amounts, especially in fresh form, can cause a negative reaction. Moreover, many patients do not associate garlic with their headaches because they see it as a healthy food and continue consuming it regularly. If you suffer from migraines or frequently experience unexplained headaches, eliminate garlic from your diet for at least 2 weeks. Keep a food journal and track any changes in your condition. Be especially careful to avoid fresh garlic, garlic sauces, and supplements. If your symptoms improve, speak with your doctor about the possibility of permanently removing garlic from your diet or replacing it with other spices. 10. Avoid garlic if you have inflammatory skin conditions such as psoriasis, eczema, or dermatitis. At first glance, garlic seems completely safe. It is a familiar natural product that is widely recommended for boosting the immune system. But this very property makes it potentially harmful for people with autoimmune and inflammatory skin conditions. In such cases, the immune system is already acting aggressively, attacking the body's own cells, and garlic can further intensify this unwanted inflammation. Garlic contains sulfur compounds, including allicin, which stimulate the immune response. This can be beneficial during infections, but for individuals with chronic inflammatory skin conditions, such as psoriasis, atopic dermatitis, or eczema, garlic acts as a trigger. It increases the production of cytokines, the molecules involved in the body's inflammatory response. As a result, the skin may react with a new flare-up: redness, flaking, itching, and in some cases burning sensations and worsening rashes. In the year 2024, the American Clinical Dermatology Group conducted a study of 312 patients with confirmed psoriasis. Among participants who consumed more than 2 cloves of raw garlic daily, 39% experienced flare-ups. Their rashes spread, itching intensified, and their skin became sensitive even to neutral skincare products. In some cases, garlic also caused irritation when applied directly to the skin in homemade masks, ointments, or compresses. People who use garlic in concentrated form or as supplements should be especially cautious. Capsules containing garlic extract deliver a much higher dose of active compounds than a regular clove. These higher doses can have a systemic effect, spreading inflammatory activity throughout the body, including the skin. If you suffer from chronic inflammatory skin conditions such as psoriasis, eczema, or dermatitis, limit garlic intake to minimal amounts, completely avoid garlic-based supplements, and do not apply it topically. Before reintroducing garlic into your diet, consult with a dermatologist and track your skin's response in a food diary. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.